Good afternoon. I'm Adrian Dix, BC Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. It's International Nurses Day today. We wish everyone well, and we want to recognize and honor the territory of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations. And with that, I'll introduce Dr. Henry for today's COVID-19 update.
Thank you, and good afternoon. So for today, May 12th, I'm pleased that we have only 7 new cases who have tested positive in British Columbia today, and that brings our total to 2,360 people who have tested positive in the province, including 874 in the Vancouver Coastal Health Region, 1,124 people in the Fraser Health Region, 125 people in Vancouver Island Health Region, 180 people in the Interior Health Region, and 57 people in the Northern Health Region. We continue to have outbreaks, as you're aware, in long-term care and assisted living. We have no new outbreaks to report, and we are up to 482 people who are associated with long-term care assisted living, or the number of acute care units that we have outbreaks ongoing, including 295 residents and 187 staff. We also have no new community outbreaks to report today. So in terms of our cases, we have 397 active cases around the province today, and you will excuse my slight mathematical error yesterday when I reported 600 and some. We were at 504 yesterday, so that has decreased by a little over 100 active cases again today. Of those, 63 people are in hospital and 16 are in critical care or ICU. We have, unfortunately, 1 additional death to report, bringing our total to 131 people who have died from COVID-19 in BC. And this is, unfortunately, another resident of our long-term care home in the Fraser Health Region, and our condolences go to the families and the community and the care providers for this person. We now have 1,832 people who have fully recovered from COVID-19. Today I want to bring people's attention to one of the initiatives that we've talked about a little bit, in that we have done a number of things to try and understand the unintended consequences of the measures that we've had to take to try and control COVID-19 in British Columbia. As we know, everybody in this province has been impacted, and everybody across the country and around the globe has been impacted. The effects have been far-reaching, and we have learned a lot. We have learned a lot about the virus. We have learned a lot about transmission. We learned a lot about how to care for people, how to manage outbreaks. But there are still many, many questions that we still need to answer and understand. So today, we have launched a province-wide survey to gather your feedback on your experiences and your actions in the COVID-19 pandemic so far here in British Columbia. This is a collaboration with all of our medical health officers, our public health officers around the province, the Provincial Health Services Authority, as well as my office. And the information that we gather will help inform the decisions that we make in the weeks and months ahead. As part of the survey, there's also an opportunity for you to express your interest in participating in a number of other studies that we're setting up to try and better understand the impact of the pandemic on people here in British Columbia, including a serology blood testing study to determine immunity in British Columbia, and I know that will appeal to a lot of people, so I encourage you to look at this survey. The other study that we're looking at is getting your advice and support about how we could use technology to coordinate information sharing and contact tracing going forward in British Columbia. So this survey of your experiences and helping us to understand the impact it's had on you and your family is available on the BC CDC website. So that's bccdc.ca/COVID-19 survey. And I really encourage everybody, if you have a few minutes, it takes about 10 to 15 minutes. I encourage you to make the time to complete this survey and help us understand your experiences so far. As Minister Dix noted, today is International Nurses Day, and that is the anniversary. It's celebrated on the anniversary of the birth of Florence Nightingale, who was one of the first professional nurses and who started her own nursing school, as many people are aware. She was also somebody that I admire greatly as one of the first infection control providers that we've had in the healthcare setting, and her work during the Crimean War in helping make hospitals safer from infections and preventing infections in patients and staff in those hospitals is really legendary. She was also a statistician, which is something I admire greatly. Today, we know that BC's nurses are doing incredible work across our province, supporting patients with COVID-19, stepping up in this crisis across the province, whether they're public health nurses working in the community, whether they're nurses in long-term care in our hospital system, across the sector. We know that nurses in our communities are caring and compassionate and so much more. And I want to take the opportunity today to recognize that and to thank you for all that you do. One of the ways we can show appreciation to all of our healthcare providers, but to the nurses in our community in our lives, is to keep healthy ourselves. Protecting ourselves, our loved ones, our communities, protects all of us, including the nurses in our communities. And I just want to say a small quote from Florence Nightingale. As I said, she's somebody that I admire greatly, and she did say, "It may seem a strange principle to enunciate as the very first requirement in a hospital that it should do the sick no harm." And I think that's an important thing for us all to remember when we're talking about the things that we need to do to prevent people from getting sicker when they're in hospitals, and in particular, to prevent the transmission of infections. So thank you to all of the nurses in BC. I know there is still concern as well about how we are going to safely transition into our phase 2 here in BC. And many are understandably keen to get back to work, and just as many, from the notes that I receive, are fearful and they're concerned. They're concerned that we're going to see a surge in cases, that we're going to end up undoing the work that we have done. But we need to, all of us, be thoughtful. We are taking this slowly in our guidance, and we're taking this slowly in how we're rolling out the phases, and we need you to do that too. The orders and restrictions that we have put in place are to keep all of us safe, and that remains our number one priority. I've talked many times about the principles that we've laid out, and this remains all of our responsibility as we move forward into the next phase. We know that WorkSafe BC and the public health community are working on guidance for a number of sectors, and it's going to take us time to roll those out to support you in being able to move forward as these orders are lifted. So this is the new start of our new phase, but it will take time, and we will continue to be measured and thoughtful in how we do this. We can safely restart our province, and it is incredibly important that the heart of that is controlling this virus. For us to get our society moving again, our economy moving again, we need to maintain control of COVID-19. So we all need to continue to do our part. That means cleaning our hands regularly, covering our mouth, and wearing a non-medical mask in those places where we have to be in close contact with others, perhaps. It means keeping that safe distance and keeping our germs to ourselves. It means staying home and away from others if you are sick. And together, we can make it through this. We can continue to be safe. We continue to be kind and to be calm, and we will make it through into the next phase.
Thank you very much, Dr. Henry. I wanted to, first of all, express, and join Dr. Henry expressing condolences to the family, the friends, the caregivers, the community of the person who passed away from COVID-19 in Fraser Health in the last 24 hours. This is, we say it regularly, but it always bears repeating, a very, very challenging time for all of us to grieve, particularly in long-term care where it is The ability to contact one another and to be together isn't what it should be in normal circumstances, and isn't what we would hope it to be. But nonetheless, all of us, I think everyone in the province, from the Premier to every person, wants to express their condolences to the family, as I do, and to say that we are with them at this very, very difficult moment. Today, in terms of number of cases, is a low day in British Columbia. There were 7 cases. That makes 2,360 in total. As Dr. Henry has said, 63 of those hospitalized. Just to put that in context, that's 36 in Fraser Health, 2 in Interior Health, 1 on Vancouver Island, 2 in the Northern Health Authority, and 22 in Vancouver Coastal Health, and 16 in critical care. And in our hospital system, and you can see this in the numbers over the last few days, our number of beds available, including the extra beds we've added, especially in critical care in this time, are 3,760 empty beds, but occupancy is up to 66.3%. Occupancy in critical care is still under 50% at 46.2%. What shows some of the return to normalcy that's going on in the hospital system, and this just is the 5,354 visits to emergency rooms that hospitals across BC received yesterday. This is the highest numbers since March. As you'll recall, March 9th, which is about a typical number, there were 6,559 visits. That was reduced to 2,995 visits on April 6th, and we are now significantly above even the 4,500 45 to 4,600 we've been in the last number of days, and that reflects, I think, both a return to a little bit of normalcy in the healthcare system, and that people are feeling confident about visiting the emergency room, and if they need to be in an emergency room. And we've made significant advances in virtual care, I think, even in this period, but if they need to go to the emergency room, there is a place for them there. Tomorrow I'll be updating everyone, both the numbers of urgent surgeries that have taken place during this pandemic, and also an update on the progress we've made in contacting people around BC since we relaunched the surgery plan last week. I wanted to join Dr. Henry in encouraging people to take part in the survey seeking input from citizens on the response to COVID-19. The survey is called Your Story, Our Future, and it shows what we've known from the beginning, which is that your story and your efforts and everyone's effort in BC has had a lot to do with the results and a lot to do with our immediate future. It'll help us gather valuable information about how COVID-19 has impacted the people of BC, and it will also assist us as we continue to deal with this in the days and weeks and months and indeed years to come. Local data are essential for communities for public health planning, and they equipped our team of medical health officers across BC to support health and well-being as we learn and live with COVID-19. It takes about 15 minutes online. It's just one more step that you can take to help your fellow citizens, your community, your healthcare system to respond in these difficult times. We always need to learn. That's what we've discovered regularly, both from Dr. Henry and myself to everyone in the system. We need to learn and prepare for the future, and you can help us do this. So I want to repeat where you can take the survey online. It's at bccdc.ca/COVID-19 survey. It is currently available in English, Simplified Chinese, and Punjabi. For those of you who cannot complete the survey online or need assistance in another language, you can take the survey over the phone. You can call 1-833-707-1900 7 days a week between 8:30 a.m. and 4:30 p.m. Assistance is available in 150 languages. And as Dr. Henry has said, at the end of the survey, you'll be asked about your interest in taking part in 2 future initiatives. One, a serology survey to help determine immunity across the population, and there is considerable interest in that, and the planning for digital tools that will help identify and manage COVID-19 infections in your community in the future, and I encourage everyone to take part in that. I wanted to also bring you up to date on the issue of PPE, which we've done every Tuesday. We're continuing to make sure that healthcare workers have the PPE they need to protect themselves, each other, and their patients. As with previous Tuesdays, I want to update you on where we were as of last Tuesday, which includes over 3,750,000 N95 respirators. And I want to note that 63,000 of those are from the federal government's bulk procurement. Over 3 million surgical masks, which are our efforts, plus 146,000 from the federal government's bulk procurement. Close to 1 million pieces of eye protection, of which 44,000 are from the federal government's bulk procurement, almost 6 million pairs of gloves, and several 100,000 gowns. Today, I can tell you since that time, since last Tuesday, we've received an additional 44,000 3M N95 respirators, 85,000 alternate brand N95 respirators, which are, as I've noted before, subject to testing, 324,000 surgical masks, over 5 million pairs of gloves, close to 100,000 pieces of eye protection, and over 500,000 gowns. As always, any product we receive that isn't from a previous vendor will be tested and assessed before it gets into the healthcare system. We are also testing any alternative N95 respirators received from the federal government. Beyond our testing process, we're keeping very close contact with Health Canada and other jurisdictions as they receive PPE and test it. We're sharing information so that we can help each other to know more about which vendors or products are acceptable. Once again, I'm able to say that BC is testing and establishing a contingency of alternative products. We have not had to put alternative products into the healthcare system at this point. With the decline of COVID-19 in BC, we believe we'll be in good shape to continue to protect our healthcare workers with the steady supply we've received from our traditional, familiar vendors. I want to just on two further points thank Dr. Henry and my colleague MLA Norm Letnick for a very successful virtual town hall last night. We had close to 30,000 people tuned into the call, which is great, and it's a real reflection of the assistance and the work that MLA Letnick, Norm Letnick, the Liberal health critic, has made and contributed, as has the Green health critic, Sonia Furstenau, to our efforts in BC. I wanted to say finally that getting positive results here, getting a reduction in the number of cases is, of course, something that we're satisfied with, even pleased with when it happens, but it doesn't happen every day. Over the last week, we've also seen that modeling data has shown our progress in the COVID-19 fight. We've shared our 4-phase plan to restart BC, and we've seen the commitment to surgery renewal. We are preparing for the weeks and months ahead and the promise they offer for social, surgical, and economic renewal. But just to be clear, we just cannot get ahead of ourselves. The only travel we should be doing the next little while really is moving from phase 1 to phase 2, because COVID-19 isn't going anywhere. It's still in every health region in BC, and we can't make that trip from phase 1 to phase 2 without our passport to safety, the skills that we've learned, the skills we've been taught to keep healthy and to stop the spread of COVID-19. This means that every step we take along the path to our social and economic renewal this week, this coming long weekend, and beyond begins with this commitment. We wash our hands and cough and sneeze into our sleeves, and we use, where appropriate, a mask, a non-medical mask. Follow the rules, flatten the curve. For BC's restart plan and surgical renewal to fully deliver on their promise, we must continue to be 100% committed to stopping the spread at every step of the way in our journey through this summer and beyond. Aujourd'hui, nous annonçons 7 nouveaux cas pour un total de 2360 cas de COVID-19 en Colombie-Britannique. Nous sommes attristés d'annoncer un nouveau décès lié au COVID-19 dans le régie de santé du Fraser pour un total de 131 décès en Colombie-Britannique. Nous offrons, bien entendu, nos condoléances à tous ceux qui ont perdu leurs proches. Parmi l'ensemble des cas confirmés de COVID-19, 63 sont actuellement hospitalisés, dont 16 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. We're happy to take your questions.
Thank you. Reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question. Please also unmute your phones. You will not be audible until I call your name. First question today is from Penny Daflos, CTV.
Thank you so much for taking my question. With phase 2 around the corner and the idea of expanding our bubbles, I'm hearing from a lot of single people who've been very lonely. Some of them may be just feeling frisky. They're thinking about dating again. So I just want to hear, what is Dr. Henry's advice when it comes to sex and dating? And will we start seeing some public health messaging around that? Because I think there's a lot of confusion, concern. Are people still allowed to see each other? I know other jurisdictions say kissing is the highest risk. So any help that you could offer the single people in particular, I think would be appreciated.
Yeah, I know it's an incredibly challenging time for all of us, and when we don't have a ready-made people within our bubble, it can be even more lonely. And I think many people have adapted, I know, to online and to talking online and to having encounters online that can be quite helpful in that regard. I would say, now's the time that we need to be careful. We're not out of that place where coming together in large groups is going to be safe for a while. But yes, we can look at how do we connect with people, those people that we have been talking to online. These are our opportunities, but we need to be very careful about it and cautious about it, and make sure that we do follow the guidance around, cleaning our hands, etc. I think the really important thing, and I'm laughing a little bit because I'm thinking of some of the young people in my life who are concerned about missing some of the occasions that they might meet others. And yeah, we can do that. We have to do that. We're social people. We need that. But let's do it in small, thoughtful ways. And also, let's be really concerned about ourselves. And if we are feeling unwell or under the weather, put it off for another day. That's the really important thing right now. I also will say that, we've seen lots of people outside, and one of the people that in my life remarked to me that, now that we can't go to bars and clubs and things, going out to the park and sitting at a distance and having picnics, those are the new romantic things people are doing. And, that's an okay thing too. So let's find those opportunities to meet each other safely. And if you happen to pull somebody else, find somebody that you want to spend more close time with, then make it your own connections.
Thank you. Next question is from Rob Shaw, Vancouver Sun.
Oh, hi, Dr. Henry. Washington State has proposed, or mandated actually, that if a restaurant is going to reopen, it has to keep a daily log of all the customers, their telephone and email contact information, and keep that for 30 days to help with contact tracing if there's an outbreak. Is that something you would expect to see here in BC?
Yeah, that is something that we've seen in other situations. So, we have those requirements for places like, massage places, spas, other places where you can understand who the customers have been. I think that's a really good idea. I haven't seen the details of the BC Restaurant Association proposals, but that type of thing that helps us understand who might have been in close contact with others is something that's important to help assist us going forward. So I think that's a really good idea.
Next question is from Tanya Fletcher, CBC.
Oh, hi, Dr. Henry. You touched on this a little bit yesterday, but with more jurisdictions mandating the use of masks while out in public, you stayed away from making that a formal recommendation before. You seem to be more in favor of that now, and many of your guidelines to sectors include wearing a mask. Businesses beginning to reopen, some are requiring customers to wear a mask, others are not. Are you concerned there might be confusing or inconsistent messaging around that?
Yeah, I really don't believe we should be requiring it. There are many reasons why some people cannot wear a mask, a face covering. People who have certain respiratory illnesses, it can be very challenging and can cause breathing problems, etc. And we know that it's not possible for young children. So I do think it is something that we can do, particularly short term for those periods where we can't maintain those distances and it may be crowded. The more important thing is if you are somebody who has challenges wearing a mask or who has respiratory illness, avoiding those situations, so we need to have those sort of layers that allow us to do things safely. So if I'm somebody that is at higher risk of having illness, wearing a mask is not something I'm able to do, then maybe I go in the early mornings when there's special hours for people who are seniors or more at risk. So those are the types of things we need to think through. And yeah, it is challenging, as I've mentioned before. Our thinking around the value of non-medical masks has changed, and it's changed globally. Although I will say, we need to remind people that it's actually not for my protection that I'm wearing one. It is to keep my secretions in. So if I'm able to do that and to make sure that I can cover my mouth and clean my hands and not get close to people, then for most situations it's not needed. It is in many cultures a sign of respect, and I think that's important too. So we shouldn't be stigmatizing people either for wearing them or for not wearing them, as long as we're able to maintain our safe distances and the other measures that are important to be put in place. So the bottom line is it is a measure. It's not the most effective measure we have to prevent transmission, and there are some situations where it may be useful. And so that's where we are right now in our thinking about it. And so I do recommend it in those situations for those who are able to do that. I think the other really, of course, important thing is to stay back and stay away from others if you're sick at all.
Next is Farhan Lalji, TSN.
Hi, Dr. Henry. Thanks for taking my question. It's regarding the possibility of the NHL coming to Vancouver and British Columbia as a hub city to restart play. I know the Premier Horgan is going to be speaking to NHL Commissioner Gary Bettman tomorrow. From your end of things, how concerned are you that if the NHL does come to Vancouver, that it might put some undue stress on the medical system, particularly as it pertains to testing available for the general public? And also, another league official has suggested that if one positive test came back, it wouldn't necessarily shut the whole thing down. Do you see that as feasible?
Yeah, so there's a lot of ifs around this. In theory, I think it's a really great idea. Of course, it will depend on timing, where we are in our phases. I also think that I would need to see a very detailed plan of what their expectations or how they will meet our requirements. Right now, there's no changes that we are foreseeing in requirements for self-isolation for people who've come into BC from outside the country, so that would need to be taken into account. The ability to monitor, to care for people, to make sure that testing is available, and it would be part of my criteria that it would not have any impact on our ability to test here in BC or for anybody in British Columbia to get the testing, the assessment, or the care that they need. So we do need to monitor it very carefully. I have not yet seen a proposal that of those types of details. So I think it is very much in the theoretical phase right now. But I think we could look at the probabilities and the possibilities if and when they come forward with a proposal.
Keith Baldry, Global News.
Hi, Dr. Henry and Mr. Dix. You mentioned travel earlier. On the weekend, the Port of Vancouver official was quoted as saying they're making preparations to welcome cruise ships on July 1st, a prospect I'm sure neither of you agree with. It is a federal port. Are you of the view, in terms of talking to the federal government to ensure that cruise ships do not come in, or do you have any power over that?
Yes, we've had those conversations with our counterparts in the federal government. We are, as you can imagine, not in favor of cruise ships coming into anywhere in British Columbia. And I can tell you that my conversations with my counterparts, both in the Yukon, but also in Alaska and Washington State, are similarly not expecting to have cruise ships in our waters or in our ports in the coming weeks and months. So yes, that is not something. One of the things, as I've just mentioned, is the requirement for anybody coming into the province from outside of BC, from outside of the country, will need to self-isolate for 14 days. So if a cruise ship had somehow planned to come here, then we would not be allowing people to come off the cruise ship, for example. So, those are things that we need to work out. This is not the time for that type of a risk to be taken in our province, and certainly not in our ports, either Vancouver or Victoria or, Prince Rupert, some of the other places where these cruise ships have gone in the past. So I do expect the federal government will be looking at the issue and coming out with their recommendations, but the orders that we have in place here in British Columbia will stand through, certainly through July 1st. Yeah.
And just to say, just as Dr. Henry has, and with colleagues in both Alaska and Washington State and then across the country, I think we've been pretty clear on this point. You'll recall back before, really at the beginning of March, we suggested that this was not the year to be going on cruise ships. I think all of the evidence shows that that was at least one correct piece of advice, of hopefully more, but one correct piece of advice that people shouldn't at that time get on cruise ships. I don't think anything substantially has changed, and I think if people are planning that kind of travel, I know there are many people who are dedicated fans of cruise ships and going on cruise ship vacations that really, I think all of the evidence tells you this is not the summer for that, that the rules that we are applying to everyone will apply to cruise ship passengers as well. And I don't see anything happening with respect to cruise ships starting on July 1st, except a continuation of the present situation.
Next question.
I will note as well that there are still Canadians and others who have been working on cruise ships who continue to remain unable to dock in places around the world. And so, the whole challenge that we have had about infections of COVID-19 in cruise ships continues and is not yet resolved from the previous months. So.
Next question is from Marcella Bernardo, News 1130.
Hi, I'm going to try to sneak in two questions if I can. First to Dr. Henry, it wasn't long ago that I asked you about wet markets, and that's making headlines again in the news. Just how concerned are you about the opening up of wet markets in the world, not just in China, but all over the world? And also for both of you, if you can talk about the border control, the film industry has been asking for possibility of easing up border regulations for isolation so that especially actors don't have to wait 2 weeks to isolate themselves when they need to work on a project for only a couple of days. Has there been any discussion about possibly easing up restrictions for that kind of work?
Yeah, so in terms of wet markets, I think there's a couple of things around them. They are markets that have been traditionally around the world in many different countries, as you mentioned. We still have some ability for small numbers of live animals, chickens, for example, in some communities here in BC to be used at home and slaughtered at home. So they are very much a source of food for many communities, and it is how people get access to protein and to other foods. I think there's a difference between that type of market and the illegal trade in exotic animals for food, which is a very different thing, often happens around the same places, and it may be that a number of particularly illegal trade happens through the facility of a wet market. But we have seen in many countries in the world that if you put in the appropriate infection prevention and control measures in wet markets, they can be very safe. So I think there's two things that need to be dealt with, and in particular the illegal trade in exotic animals for food or for other measures is something that needs to be looked at, and in my mind there needs to be restrictions and put in place around that, and that is a very challenging thing to do. In terms of the borders, right now we do not foresee I do not foresee lifting those restrictions on self-isolation. We need to go through this next phase. We need to look at where we are come the end of June into the summer and see what measures can be put in place. I think right now the only thing that I see at the borders that we need to address is looking at how we can facilitate family reunification. But again, I would see that in the context of people having to self-isolate when they come here. As things improve, both in the United States and in Canada, then we can look at having different conversations around the need for self-isolation, but that we're not at that place yet. And if we look at people coming in from other places around the world, we still have travel-related cases. We've had Canadians repatriated from cruise ships, as I've mentioned, but also from a number of countries around the world that continue to be dealing with large numbers of cases of COVID-19, and they have developed their illness once they've come here to BC. So we're not at the place where we can think about lifting those types of safety measures at this point.
Next question is from Cindy Harnett, Times Colonist.
Hi, this question kind of follows on the last. The Prime Minister wouldn't say again today whether he'll extend restrictions on non-essential travel to the U.S. After May 21st. So what is BC's concern on that front? Minister Dix, you said that you might be talking with provincial counterparts last night, and maybe what came of that?
Last night, just as the Premier had, we made our position clear that the prohibition on non-essential travel has to continue into the future, and we've made that clear to the federal government. I know they're working on it. They work on those issues with the United States government in practical terms, but it would be absolutely unacceptable after the enormous sacrifice people in BC have been placed to take this risk right now. I'll just remind everyone, today especially, we are still in phase 1 of our response. We are moving to phase 2. But the risk remains very high across the province. And so we have to be prudent. And this is one of the steps we strongly believe in. It's why in British Columbia and in British Columbia alone, I think right now there is the kind of enforcement and support for people self-isolating who are returning to British Columbia and to Canada from outside of the country. Why we've continued to do that, why that, which has been led by provincial public servants, is so important to us, because we know that there have been cases of people who have come in those circumstances and have tested positive for COVID-19, and it's desirable that people do that while they're in self-isolation. And secondly, it shows our commitment to the idea of stopping the spread in every way that we can. So that's got to continue, and we're hopeful and supportive of the federal government's efforts to see that continues, but BC's position could not be more crystal clear. It cannot change now.
Next question is from Moira Witten, the Tyee.
Hi, good afternoon, Dr. Henry. Thank you so much for this update. My question is about a letter that was released today from a coalition of a couple of dozen mental health and legal advocacy organizations, hoping for more information about potential outbreaks or the discharge circumstances for patients in psychiatric units and facilities in the province. Are there any current or past outbreaks in these units, and would there be a threshold you would report these if there were an outbreak in the future?
Yeah, so I'm aware that there has been concerns about outbreaks, particularly in psychiatric facilities in other countries. There have been no cases that I'm aware of in any of our psychiatric units in British Columbia, and certainly no outbreaks that we're aware of. And we do have important measures in place to protect everybody in all of our facilities, but in particular recognizing the challenges that can be faced in some of the units or wards that are dealing with people with both mental health and substance use issues. So there are special provisions being made in those places to ensure that if needed, people are tested, that they can be isolated, that people have the support that they need. I know one of the challenging things, of course, has been that we have not allowed visitors, and that can be very challenging for people who are dealing with their mental health issues in a hospital setting. And so it again goes to the importance and the value that our healthcare teams, our nurses and physicians and aides in those settings are doing to support those people going through this unprecedented crises and having to deal with those issues of separation from supports as well.
Lisa Cordasco, CHLY.
Thank you. I hope that both Dr. Henry and Minister Dix can respond to my question. How concerned are you with the conspiracy theories related to COVID-19 that are circulating on social media platforms and are being played out in protests like the one in front of St. Paul's Hospital last Sunday? And are there any steps that you're planning to push back against it, or do you just see it as a fringe group that's very small and is best ignored?
Yeah, it's really challenging because there's a lot of stuff out there that has a bit of truthiness to it, and I know people send me lots of things that they think are the conspiracies. That there's a number of people who call themselves physicians in a number of different places, particularly from the U.S., who have put out information that they believe shows things like comes from a lab, clearly, that staying at home somehow makes our immune systems weaker. It's very challenging, and one of the ways that I think is very important is the fact that we do come out here and provide you with the information that we have. I provide you with as much as we know, and encourage people to go to reputable sources of information. So the Health Canada website, the Public Health Agency of Canada, our BC CDC website are sources of truth, and you can go from there to other links. The BC government COVID webpage has information as well. And there's a number of people that have been trying to address some of the misinformation out there. I think it behooves all of us to take a deep breath, and when something comes out that is wildly out there and seems to be credible, sometimes when we're not around our usual people, when we're self-isolating, we don't have somebody to bounce those ideas off of. We put it out on social media right away, and that's a way that we know we can connect with people, and many people will be are looking for that reason, looking for an answer that makes sense to them. And we see that as well when people are going through the anxiety and the fear that something like a new outbreak of a new disease happens. So I would just say, the mantra that I say all the time: we need to be calm. We need to take a deep breath, take a good look at it, look at some reputable sources of information, and that will help us find the right way forward through this.
I think one of the reasons we've given such regular briefings, that we've delivered information when it's good news, when it's more difficult news, when we've acknowledged the price of COVID-19 in BC. I think we should just reflect on that. 131 people have passed away. Many people have suffered the very serious health difficulties that come with COVID-19. People have lost their work and so on. I think we owe it to them to be respectful of truth, and to be straightforward with the evidence. And that's what we're trying to do here. I really encourage people not to encourage it even by reacting to people who are taking steps that are designed to produce a reaction. I am very proud of British Columbia. This is a long time behind us now. It feels like a long time. It was 3 or 4 months since we started, since the emergency response to COVID-19 started in January in BC. In that time, people have come together. People in the legislature have come together. Last night, we hosted our event with Norm Letnick. We've hosted events with Sonia Furstenau from different parties in BC. People have come together to provide the information to support each other in this time. And there are always going to be people who want to pursue another agenda. But I think what we have to think of is all those people who have had their surgeries canceled, all of those people who have not been able to see their loved ones, all of those people who have had to struggle in self-isolation and recovered from COVID-19. To be true to them, we have to be true to ourselves and continue to act to protect one another, continue to follow, not bend the rules, continue to not to see this as an opportunity to do anything else but come together and support one another. I'm very proud of our province and its response to it, and I don't think the attention that's paid to a very small number of people in BC, frankly, is necessarily warranted. I think we've got to be careful not to, in our reactions to things, raise them up too much. I think the truth is, Lisa, that we've seen an extraordinary response from BC, and one that we can all be very proud of.
Next is Richard Zussman, Global News.
Just to follow up on a few things from earlier in the call, Minister Dix, are you concerned about this perception out there of this double standard for the NHL, that while people are being told, stay at home, limit your contact, there's thoughts of a big organization coming to British Columbia and bringing with it hundreds of people? And to Dr. Henry, to the first question, the kissing part, is that something that people should be concerned about, spreading the virus through kissing?
Okay. I got the easier question. Thanks, Richard. No, I don't think so. What we're going to do is when there's a plan, if there's a plan, and right now there's a lot of interest, obviously, for people who are fans of professional sports. It's been a long time since the major leagues have operated, since the Western Hockey League has operated, since the baseball season. All these things have happened, so there's a lot of interest in this area. But what's going to happen is that, as in every other case, as in every other industry, we have to assess real plans and work together to ensure that everybody is safe. And that applies to the NHL as it applies to every single other organization. And that's what's going to happen in BC. And I'll turn it over to Dr. Henry.
I will say, I'm not going to compromise safety for any organization, whether it's the NHL or anything else, as much as I love hockey. And I will say I miss the Victoria rain as well, and I hope to see you again sometime soon. In terms of kissing, yes, absolutely. This is a respiratory virus that spread through droplets. So yes, we've seen it with other diseases that can be spread this way. So yes, I would expect that if somebody was sick with it and they were kissing somebody else, they could actually quite effectively pass it on that way. So it is the close contact that can happen. So that's why I guess I didn't say it quite very clearly, but if you are going to start a relationship with somebody, this is not the time to do rapid serial dating, okay? So pick somebody, see if it works, and then take your time. If you're going to be pulling them into your small circle, then make sure that you're the only one in their circle as well. And we talk about the contacts and the fact that if the people I have contact with, it means that I'm contacting their contacts too. So if they're somebody who has been with a whole bunch of other people, then my risk would go up that they might be infected with this. And we know that people can transmit it early on in their illness when they're not realizing they're sick themselves. So I think we all need to take a little bit of responsibility right now coming into the next few weeks particularly. We are seeing this decreasing in our community, but it is still here now. So we need to take extra precautions, making sure that we're staying away from others if we're feeling the least bit ill, or if we've been in contact with somebody who's ill, then we need to keep our distance and keep our germs to ourselves for a while.
We have time for one more question this afternoon. A reminder to everybody on the phone, if you did not get to ask a question this afternoon, there will be a statement released later today with all the information covered. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Dominique Levesque, CBC Radio Canada.
Hi, I'd like it in English and in French. So, Dr. Henry, Tofino is asking BCers not to come to their small town because of COVID risk, but in Ontario, Niagara is, on the contrary, asking Ontarians to visit to support the local economy. So what do you recommend to people in the province in terms of travel in the province as the summer months approach, businesses reopen? Is it okay to travel locally, or should we all stay in our own cities for the whole summer?
Yeah, no, I think it's a matter of progression and timing. And so I don't think we're saying things that are at odds. I'm saying right now, as I've just said, we still have 400 people in our community who are recovering from this virus. We know there's still some spread in our community. We have 20 long-term care facility hospital outbreaks that we're managing. We still are in outbreak phase with a number of community outbreaks. So that tells us it's still here right now. So right now, this weekend, stay close to home. Don't go traveling. I absolutely think that as we continue to take the measures we're taking, that we're all doing together, and if we safely, gradually open up our businesses, our economy as we're going into the end of May and into June, then we need to look at this. We need to support our businesses in smaller communities, but we need to do it in a way that is protective as well. So if I own a summer cottage in a small community, you know, yeah, let's go there, but let's not overwhelm that system. Let's bring our food with us so that we're not creating lineups and havoc at the local grocery store, particularly when we know that it can be a challenge to restock sometimes over the coming weeks and months. But I do think, you know, I've said this before, we need to think about having our summer vacation in BC. We have many beautiful places here in BC. So let's look at BC for people in BC this summer. That's a way that we can keep each other safe, that we can support our local businesses, but we need to do it in a measured way and being mindful of the constraints that we have in some of our smaller communities. I will also say we need to be very mindful of our Indigenous communities, or the Indigenous communities in BC and the First Nations communities in BC, many of whom are understandably wanting to protect their own communities in ways that may seem different for us, but their decisions, and we need to support those decisions. So don't think about going to a First Nations community unless you're invited. And I think that's something we need to be very sensitive through the summer as well.
Je pense que c'est clair que nous suivons notre propre chemin en Colombie-Britannique, c'est-à-dire que je sais qu'il y a des circonstances différentes en Ontario, mais ici, nous sommes dans la première période de notre réponse au COVID-19. Et les conséquences sont sérieuses pour tout le monde. On a le COVID-19 un peu partout dans la province, et donc il faut répondre d'une manière mesurée. Nous sommes, comme je viens de dire, dans la période 1 seulement. Donc, ce week-end, notre recommandation, c'est de rester chez vous, dans votre propre communauté, de ne pas voyager un peu partout dans la province, de ne pas voyager à d'autres provinces, mais de rester dans votre propre communauté. Elle est bien entendu dehors, parce que c'est ce qu'il faut faire pendant le mois de mai en Colombie-Britannique, mais je sais qu'il y a d'autres circonstances, peut-être en Ontario, et ça peut développer en Colombie-Britannique, mais je pense que nous allons réussir si on suit les conseils du Dr. Henry et de rester dans sa propre communauté ce week-end, surtout pour continuer nos efforts de réduire la transmission de COVID-19 en Colombie-Britannique. Merci beaucoup. À la prochaine. See you the next time.
Thank you.